Good afternoon. As a land-grant institution, we would first like to acknowledge the Gabrielino Tongva peoples as the traditional land caretakers of Tuvangar, that is the Los Angeles Basin and South Channel Islands. Welcome to the 2022 Health Policy Seminar Series at the UCLA Center for Health Policy Research. My name is Catherine Keatsman, and I am a senior research scientist and the director of the Health Equity Program here at the center. I am thrilled to be here today to share findings from our research on immigrant health and state policy, or rights study, which was designed to understand the experiences that Latinx and Asian immigrants who live in California have encountered in the areas of healthcare, social services, employment, education, and law enforcement, and how these experiences have had an impact on their health and access to healthcare. As always, if you would like a PDF copy of today's presentation, please email the communications department at healthpolicy@ucla.edu. This webinar is being recorded and will be available on our YouTube channel in the coming weeks. Again, thank you for joining us today. We would like to dedicate today's presentation to the memory of Steve Wallace, the rights study principal investigator who brought his extraordinary scholarship and sensitivity to research on immigrant health, created the rights study, and led it until his untimely passing just over 1 year ago on March 30th. In addition to being a brilliant researcher in immigrant health, aging, and public health, Steve was an exceptional colleague, mentor, advisor, and friend. We miss him dearly, but remain grateful for all of the good that he taught and inspired us to pursue. We would also like to acknowledge the many, many talented individuals who have contributed to the rights study. Here are the names and a Zoom screenshot of our research team, which includes both faculty and graduate students. We are truly grateful for the funding from the National Institute on Minority Health and Health Disparities that has supported this work. We have also been given sage advice by representatives of several community-based organizations who have served as our community advisory board and helped us ground this work in what is happening in the real world. We have benefited tremendously from the input provided by a technical advisory committee of experts who have helped to inform our approach and placed our research in the context of what is already known and what needs further exploration. The research on immigrant health and state policy aims to understand how California's immigrant policy environment influences access to healthcare by identifying the ways in which the state's health and welfare, education, labor, and law enforcement policies shape Asian and Latinx immigrants' lived experiences of opportunity and exclusion. Between 2018 and 2020, we collected statewide survey data for more than 2,000 Latinx and Asian immigrants in California. We also collected in-depth qualitative data from 60 in-person interviews conducted with 28 Chinese and 32 Mexican immigrants in 2 California counties in 2018. During this webinar, we will present findings from the 15-minute survey that followed participation in the California Health Interview Survey, also known as CHIS. The survey was administered by phone and on the web and was conducted in English, Spanish, Mandarin, Cantonese, Korean, and Vietnamese. Data from the Rights Follow-On Survey were merged with CHIS data in order to create a more complete picture of study participants, their demographic characteristics, and health-related concerns. The Rights Survey included 75 questions about immigrants' experiences of exclusion. The data we present today illustrates how the lived experiences of immigrants in California are affected by multiple institutional policy structures, such as education and employment, which have differential impacts by immigration status and by racial or ethnic identity. I am delighted to be joined by 3 of the rights team investigators today who will share findings that we have recently published as a series of 4 fact sheets. Dr. Nadare Purad will present findings about immigrants' perceptions of the immigration climate. Dr. Michael Rodriguez, who was scheduled to present today, was unable to attend, So Dr. Parat will also be presenting findings about immigrants' perceptions and experiences with the public charge. Dr. May Sudanaraset will present findings about immigrants' experiences of exclusion in employment and in law enforcement. And Dr. Maria Elena Young will summarize and discuss the health and policy implications of these findings. At the end of the presentation, we look forward to responding to your questions and comments, which we encourage you to post throughout today's session in the Q&A box at the bottom of your screen. The Right study looks at how immigrants' experiences with immigrant policies affect their access to health care. Our framework treats immigrant policy as a social determinant of health, which shapes the extent to which immigrants are included or excluded in California. This graphic shows pathways between immigrant policies and access to care. It indicates that social exclusion creates barriers to care, and that the eligibility, rights, and protections related to immigrant policies can translate into experiences of exclusion that in turn translate into barriers to care. Our study is guided by this framework of how immigrants experience policy in California. We first consider perceptions of the policy climate, which at the broadest level are concerned with the policies that shape individuals' perceptions of the society they reside in, the nature of their community, and their place in both the broader society and at the level of their local community. We then look at the individual level, where people exercise agency and interact with the context in which they live by making choices about how they will act or behave in response to the policy context. Our study further considers both the observed and the direct experiences of inclusion and exclusion. Observed experiences involve observing others in the community and how they experience the effects of policy, while direct experiences of inclusion or exclusion occur at the individual level and assess how individuals are directly affected by policy. These experiences of exclusion exist and frequently intersect across the policy sectors of healthcare and social welfare, employment, law enforcement, and education. So I will now turn it over to Dr. Parat, who will discuss findings related to immigrants' perceptions of the policy climate and the perceptions and experiences of immigrants related to the public charge. Dr. Parat.
Thank you, Catherine. Thank you for that introduction about several years of work that we have been doing to gather data and also analyze the findings that we're showing today are the, I guess, the tip of the iceberg of the different types of analysis that we're doing with the data. What I'm going to present first is on the perceptions of the policy climate, which we asked a sample of approximately 2,000 respondents in California. We were particularly interested in perceptions because perceptions are based on a number of things. Perceptions are based on direct experiences of individuals. They're also based on experiences of friends and family, so indirectly, but more proximal. They're also based on broader experiences in the community and also what you might hear on the media. Negative perceptions have negative consequences on different things. They can erode confidence in the healthcare system. They could also prevent individuals from accessing care through other pathways. Reduced access and lack of confidence can further negatively impact health status. So next slide. So we asked the respondents a number of questions on perceptions of the policy climate. Next slide. So we looked at discrimination, perceptions of whether immigrants are discriminated in the workplace, whether they have equal access, whether their legal status is jeopardized if they use government benefits, et cetera, et cetera. What we found is that the most common perception reported by the survey respondents were that immigrants are discriminated in the workplace due to skin, color, or the accent. And that's about 70% of the respondents. The second highest perception that we noticed and identified were the legal status, that immigrants' legal status is jeopardized if government benefits are used. And the third most common was immigrants are stopped by immigration officials while traveling. Looking at the less common indicators or perceptions, you can see that unequal access to perceptions that immigrants have unequal access to healthcare is the least common. Only about 21% of the respondents said that. And then there are these other perceptions that immigrants are not protected from immigration officials at the clinic where they seek healthcare, at work, and also in their neighborhoods are less common than the other ones, though they're not insignificant. So we're ranging from 37% to 40%. The second way that we looked at these perceptions was to see whether the perceptions differed between the two major groups that were in the survey, the Latino population, as well as the Asian population. And it was clear that the perceptions differ between these two populations. So in terms of discrimination in the workplace, unequal access, legal status, the riskiness to call police when needing help, or being stopped by immigration officials while traveling, all of those perceptions were more common among the Latino population compared to the Asian population. Being stopped by immigration officials particularly was more dramatically different between the two groups. So 38% versus 75%. In contrast, the perceptions of being protected or not being protected from immigration officials at the clinic or the workplace was pretty similar between the two population groups. And for perceptions of being safe in the neighborhood from immigration officials was in fact the opposite of other results where the Asian population were more likely to report such a perception at 46% versus the Latino population at 37%. So looking at the implications of these findings, you can see that it is important for us to understand the underlying causes of negative perceptions, particularly for the Latino population. And we also wanted to note that we live in a state with perhaps arguably more immigrant-friendly policies. And yes, we are noticing high rates of negative perceptions by immigrants. So there is a disconnect between these two factors. And what we want to know is whether promoting more immigrant-friendly policies is going to change these perceptions, and whether the problem may be in part due to the fact that immigration-friendly policies are good to have, but perhaps they're not implemented in a way that are impacting people's lives and are leading to these negative perceptions. And if that is the case, we need to address that issue. The other possible explanation is that perhaps not everyone is aware of the immigration-friendly policies, and we need to also address that by raising awareness. And the more we are able to address these negative perceptions, perhaps we could turn the needle on inequities in health status. The findings that I just mentioned are provided in more detail in the fact sheet that you see here and the infographic that accompanies it. And I invite you to look at those results as well. So now I'm going to switch to the second fact sheet that we have produced and explain some of the results of those findings. This time, we're going to narrowly focus on the perceptions and experiences of public charge and the fact that these particular experiences can, in fact, keep people away from receiving some important benefits. Moving on to the actual concept of public charge. Public charge is essentially an assessment made when a non-citizen requests admission or applies for lawful permanent residence or a green card in the United States. And under the most recently proposed rule under the previous administration, public charge refers to a person who's likely to become primarily dependent on the government for subsistence. And I'd like to note that the idea of the public charge is not new. It has, in fact, been there in US policy and politics from early on. So sorry, can you go back? So many of the non-citizen populations that are in the US are in fact not subject to public charge. And there are some examples that are listed here. So it is important to know that when you talk about, when you sort of rule and publicize such policies, it could have real impacts on unintended populations. So let's look at some of those findings. The negative perceptions that we were, the negative perception of public charge here are based on two questions. One was whether people have a perception of that public charge is present and can impact them. And the other one is whether they report that they in fact did not get benefits because they were worried about public charge. So one is a perception, the other one is a direct experience. And as you can see here, we looked at who is reporting experiences of public charge by immigration status. And that is because some of the populations that are reporting, you don't expect them to report such experiences or perceptions. So as you can see in the red box, even the perceptions are most common, both experiences and perceptions are most common among the population that does not have a green card. But what's interesting, or perhaps a more negative finding, is that you still have individuals that have a green card or are naturalized citizens, and they're still reporting perceptions, negative perceptions and experiences. That's the 13% of naturalized citizens and 27% of those with green card. You also have in the middle, you see a box of a group that are only reporting negative perceptions, but they are not reporting any experiences. And you have 51% of naturalized citizens also talking about having perceptions of public charge. And you see that among those that have green card, and technically that these kinds of policies should not impact them. The second way we looked at this data was also by Asian American and Latino population. And you can see here that the perceptions of negative perceptions and experiences are most common among the Latino population. So that's 26% versus the 11% among the Asian population. When you look at negative perceptions, it's a similar picture, though the difference between the two groups perhaps is a little bit less, 52% for Latino population and 44% for the Asian population. So we do show that there are many immigrants that do have negative perceptions, and particularly those that you don't expect to have negative perceptions or experiences, including those that have legal status. And you can see that it's also most common among the Latino population. So we do need to understand that these kinds of policies, even when they may not, when the policy is noted, even if it's not closely implemented, it still has negative influences on the population. It keeps people away from seeking public benefits that are frequently crucial, particularly among lower income individuals, and has real consequences. The negative perceptions that keep you away from public benefits could also have health consequences. And those are other factors that we're interested in exploring in additional studies. As with the previous study, we do have, you can look at the fact sheet and the infographic and read more about these concepts that we just talked about. And now I would like to hand off the presentation to Dr. Sudhanara Seth.
Great, thank you, Dr. Porat. So I'll be presenting immigrants' experiences of exclusion in relation to employment as well as law enforcement. So employment is another policy domain that can result in exclusion or violations of rights. This includes being exclusion completely from the labor force market, or can result in violations in the workplace. Employment policies are an important social determinant of immigrant health. In the US in particular, healthcare access and employment are closely intertwined given the reliance on employer-sponsored health insurance. Because of this, those without documentation status or in lower skilled employment sectors may lack access to health insurance. It should be noted that in our sample, over 26% or over 1 in 4 immigrants in our study reported ever being undocumented. So with a history of undocumented, even if they have legal status now. We know that legal status can influence immigrant work trajectories across the lifetime, but there's little quantitative data that measures workplace exclusion or workplace violations. Little is known about how one's undocumented status influences specific employment exclusions and workplace violations. And to fill this gap in the literature, the Wright study developed measures of employment exclusions among immigrants. Here are our results. We asked respondents about exclusions from getting jobs and violations at work. So the first column shows exclusions from getting jobs, including 4 items with examples such as being unable to apply for a job due to legal status or settling for a job. The second column is violations at work, including 4 items, including not being paid for work, asked to perform harmful tasks. The chart here shows the average number of employment exclusions, and it's stratified by ever versus never undocumented, with the dark blue representing those who were ever undocumented. In the first column, you see that immigrants who previously had undocumented status are nearly 2 times more likely to report exclusions from getting jobs. And in the second column there, you see that those who were never undocumented reported 0.46 violations at work compared to 0.91 violations for those who were ever undocumented. Next slide. When we look at the total employment exclusion, so this consists of these 8 indicators across both exclusions as well as violations at work, we see that those who were ever undocumented report almost twice the number of employment exclusions, with 2.28 average instances for those who were ever undocumented compared to 1.19 for those who were never undocumented. Next, we looked at the specific indicators, and we see here that across the board, those who were ever undocumented, again in the dark blue, were more likely to report employment exclusions for every indicator, which is listed on the left-hand side. The top 3 most common experiences of exclusion include being unable to apply for a job due to legal status, settling for a job that paid less than they deserved, and being injured at work. So you see that those with a history of ever being undocumented were more likely to report being unable to apply for a job. We see that 49% of those who were ever undocumented reported being unable to apply for a job due to their legal status, compared to 21.6% among those who were never undocumented. Similarly, 47.3% of those who were ever undocumented settled for a job compared to about 29% of those who were never undocumented. So we also see that there are differences in the types of jobs that those with a history of undocumented status are able to get compared to those without that history. So we see significant inequities across the board, with almost 20% of ever undocumented reporting being at risk of losing work authorization compared to only about 7% of those who were never undocumented. Our results show that regardless of documentation status, Latinx and Asian immigrants, which is the sample that we have in the right study, experience high levels of employment exclusions and workplace violations. These data are novel in highlighting the different forms of employment exclusions and violations that can occur in the workplace. However, exclusions are particularly acute for those with a history of undocumented status, who are more likely to report ever experiencing employment exclusions and workplace violations, both ever as well as in the past 12 months. So in conclusion, immigration status is a significant source of stratification across the life course. We need to not only consider how someone's current immigration status affects their health and well-being, but how someone's history of undocumented status may impact work trajectories, which may result in worse health care over the entire life course. For more information, please visit our fact sheets and infographics on the CHPR website. And I think our administrator will maybe put that in the chat for you all in case you're interested. So next I'll be talking about immigrants' experiences of exclusion related to law enforcement in particular, also from the Wright study. So immigration enforcement is another area of policy that influences immigrants' day-to-day lives. Enforcement policies influence immigrants' sense of safety and trust as they seek healthcare and can result in discrimination and chronic stress, which are linked to longer-term poor outcomes. Federal immigration enforcement policies authorizes the surveillance, policing, and deportation of non-citizens. We know that immigration enforcement policies include a wide range of federal, state, and local policies that authorize enforcement against non-citizens. Policies include the sharing of information between local law enforcement and federal immigration authorities, and the detention and deportation of non-citizens. Because local law enforcement actions, such as racial profiling or arrests, may be the first contact that immigrants have with the enforcement system, our study, the Wright study, sought to understand Asian and Latinx immigrants' experience with both local, or in this presentation, the county level, and law enforcement and federal immigration systems. Here again, our results. We asked respondents whether or not they had experienced any of 6 encounters with law or immigration enforcement. We first looked at Asian and Latino immigrants' experiences. And in this chart along the bottom, we identify each of the 6 encounters with law enforcement. The dark blue are the Latino respondents, the gray bars are the Asian respondents, and overall we see a higher proportion of Latinos compared to Asian immigrants reporting having enforcement encounters or experiences. So examples here include staying indoors to avoid law enforcement or being watched by law enforcement. And a couple of examples on this slide, overall 1 in 4 Latino immigrants reported having stayed indoors to avoid law enforcement, and about 3 in 5 knew someone who had been deported. Next slide. So there are some of the, these are some of the first data of this kind that we have for both Asian and Latino immigrants. It's noteworthy that despite differences between these groups, notable proportions of members of both groups have had these experiences. So here in the arrow there, you see that 16% of Latinos reported having been racially profiled, and about 10% of Asians also reported being racially profiled. We also looked at this by California region. So in California, numerous policies have been enacted and implemented to try to disentangle the relationships between local law enforcement and federal immigration authorities. However, local jurisdictions have not all complied with the policies at the same level. So we're also wanted to see how these experiences may be different across 3 state regions in particular. That includes the Bay Area, Southern California, both of these largely urban areas, and then the San Joaquin Valley, which is largely agricultural and rural. So across the bottom, you see, again, the 6 enforcement experiences. The dark blue represents the Bay Area. The dark gray is Southern California, and light gray is the San Joaquin Valley. Next slide. So we see across all 6 enforcement experiences, there's a clear trend in which higher proportions of residents of the San Joaquin Valley reported having experiences with law enforcement and immigration authorities. So just to highlight a couple, so the first column there, 20% of respondents reported seeing immigration enforcement authorities in their neighborhood in the San Joaquin Valley. This is compared to 12% in LA and Southern California, and only about 4% in the Bay Area reported this. In the last column, you see 44% of folks said they knew someone who was deported in San Joaquin Valley. This is compared to about 1/3 of folks in LA and Southern California, and about 17% in the Bay Area. So these data show that both Latinx and Asian immigrants experience high levels of immigration and law enforcement exclusions. One aspect of this data that's quite novel is that previous studies have primarily focused on Latino populations. This is one of the first data for us that highlights insights into what might be happening in Asian immigrant communities as well. Second, contact with law and immigration enforcement is higher in the San Joaquin Valley than the Bay Area or Southern California, and this is pretty much across the board in terms of all the indicators that we looked at, suggesting possible variation in local level policies. This includes sheriffs or police departments and how they might differentially implement laws. So if you are interested in getting a deeper dive into these data, please again visit our fact sheets and infographics, and I will turn this over to Dr. Maria Elena Young.
Great, thank you, May. So in this last segment of our presentation, I will discuss the overarching implications of our survey findings and give you a bit of a glimpse about the next phases of the rights study. So just as policies related to structural racism, gender, and income inequality have been recognized as social determinants of health, there's mounting evidence that immigration-related policies are also a social determinant of health. As we were able to see today in these data in each fact sheet, the rights survey provides us with an overview of a wide range of experiences that Latino and Asian immigrants have had living under federal, state, and local policies in California, including looking at subgroups based on those who have ever been undocumented or who live in different regions. So to highlight some of the kind of key implications of our findings, first, the data gives us a picture of how policies shape the social and economic conditions in which immigrants live. Law enforcement policies, for example, influence the extent to which immigrants may come into contact with our nation's enforcement and deportation systems, while employment policies shape the types of economic opportunities immigrants can pursue based on their legal status. And immigration policies such as the public charge rule have functioned as de facto health policies, really shaping immigrants' understanding of their rights and their sense of safety or willingness in accessing public benefits. These data have also showed that policies across different sectors affect both Asian and Latinx immigrants. Immigration and immigration-related policies have historically been used in the US to shape the racial and ethnic demographics of the nation and shape the racial position of different immigrant groups. So as we were putting this study together, we really felt it was critical to understand how different groups have experienced immigration-related policies. And in the rights study, we focused specifically on Asian and Latino immigrants because they are the 2 largest immigrant groups in the country. Here we've been able to present, as May commented, some of the first comparative data of both Asian and Latino immigrants' experience with these policies. As was noted, we observed differences in patterns between the 2 groups, which are important to understand and explore more. But overall, really, the message I want to make sure kind of comes across is that our policies can have an impact on different immigrant groups of different racial and ethnic backgrounds. And this is really critical to understanding public health overall and promoting the well-being of different groups. And then finally, Latinx and Latino and Asian immigrants have experienced different forms of policy across multiple sectors. And so really our study, we hope, kind of sends the message and provides the data to understand that it's not any one single policy that might influence the well-being of this group, but really it's how these groups are exposed to numerous intersecting experiences. And the data that Nadi presented to us about the policy climate really reinforces that intersecting policies as a whole can create an overall climate in which respondents in our study and immigrants more broadly across the state of California may perceive an overall negative climate and treatment towards immigrants, regardless of what policies are actually in place. So the next stages of the rights study are really to take the data that we have presented to you today in our fact sheets and look at how it's associated with different outcomes available in the CHIS survey data. So I'm going to share with you a couple of findings from preliminary analyses and sort of hopefully excite you about what's coming next from the rights study. So first, in one of our analyses, we sought to look at how employment exclusions may be related to Asian and Latino immigrants' ability to get needed healthcare in a timely way. In preliminary statistical analysis, we found that rights respondents who had experienced wage theft and that had been asked to perform dangerous jobs had doubled the odds of having delayed healthcare in the last 12 months. Further, not shown here on the slide, there was actually a cumulative effect across all of the employment exclusion measures. Each additional exclusionary experience in employment and in the workplace was associated with an additional increase in the likelihood of delaying care. So these preliminary findings suggest that violations of workers' rights and their protections may produce conditions such as perhaps fear of employer retaliation or concerns about financial stability that create barriers to getting needed and timely care. And the more times Asian and Latino immigrants experience employment exclusions, the greater the likelihood that they delay care. In another analysis, we looked at how the law enforcement exclusions were related to delays in healthcare. And similar to employment, we also found a relationship. Rights respondents who had been racially profiled by law enforcement and who knew somebody who had been deported were 60% more likely to report having delayed care. Similarly, there was also a cumulative effect. The respondents who reported more of the enforcement experiences, again, the 6 experiences that May shared, those respondents had the highest likelihood of delaying needed healthcare. And then finally, I want to highlight, Catherine described at the beginning of the presentation that we have also conducted in-depth interviews with Chinese and Mexican immigrants in 2 California counties. I want to highlight these data as really an opportunity to explore rich data, narratives of immigrants' lived experiences that give us insights into the more nuanced insights into the ways that different policy sectors intersect, shape immigrants' healthcare access. So here to share with you is a recent paper using these data, and maybe we can put into the chat a link to this paper. What we found in this paper, looking at how immigrants' barriers to healthcare was duly shaped by legal status and employment policies, was that as immigrants sought to obtain lawful permanent residency, essentially a chance to have a path to citizenship here in this country, they often had to limit their employment options and settle for jobs that were less likely to provide health insurance. And so in navigating these policies, immigrants are often making trade-offs and decisions about how best to kind of find rights and protect themselves, but also finding often exclusions and barriers in the process. In the long term, our hope is that the rights study helps us to understand the potential impact of different immigration policies on healthcare access and health status. In the short term, the data that we presented today have some immediate policy implications. So overall, these data suggest that despite being a relatively welcoming state for immigrants, there are still significant proportions of Latino and Asian immigrants in California that have contended with policy exclusions and that perceive the state has a discriminatory climate for immigrants. This is critical to consider as we move forward with different policy responses and community-based initiatives. Based on these findings, it's critical to ensure that California's inclusive policies protect all immigrants. So this includes making sure that those who are eligible have access to public benefits, that workplace protections are supported regardless of legal status, and that there are protections from federal immigration enforcement across the entire state. And finally, these data really point to the importance of ensuring that inclusive policies that we have in the state translate into inclusive communities. So this includes equitable implementation of inclusive policies across the state, ensuring that all regions and all subpopulations of immigrants are able to benefit from the policies we've enacted in this state, and also efforts kind of at the community level to make sure that individuals are aware of their policy, their rights and protections under these policies. So I will leave it at that, handing it over now to Tiffany so we can have Q&A, and looking forward to all of your questions. Thank you so much.
Thank you so much, Dr. Young. Good afternoon, everyone. My name is Tiffany Lopes, and I'm the Director of Communications here at the UCLA Center for Health Policy Research. We're going to be going through questions from the audience today, so I encourage you to use the Q&A function in Zoom to ask questions. So the first question is on the perceptions fact sheet. Dr. Porat, do you know if immigrants are receiving or have received any public benefits?
So that's something that we are interested in looking at. Some just to note that we have access to that information in terms of public benefits for the lower income populations, those under 200% of the federal poverty guidelines. So it is not going to be inclusive of everyone that we have in the sample, but we are going to be looking at it as this is an important question.
Thank you. This question is for Dr. Sudin-Araset. Can you describe how employment exclusions and violations at work were measured?
Sure. Yeah. So we looked at total employment exclusions, and that consisted of both being excluded from getting jobs. So there were 4 items on that. That included unable to apply for a job due to legal status, settling for a job that paid less than they deserved, having their work authorization being at risk, and then being unable to get hired. And then our second kind of domain of employment exclusion was around violations at work. And those also included 4 indicators. So it was not paid for work, asked to perform harmful tasks, being injured at work. And then among those who were injured at work, having an unreported work injury. So we looked at those kind of both separately and then looked at the total score as well.
Thank you. This is a question we've actually received a couple different ways, so a popular one. Asian and Latino immigrants are very diverse, including national origin and language. Have you analyzed differences in attitudes or discrimination indicators disaggregated by country of birth and language? And if not, are there plans to look deeper into these data?
I guess I can answer quickly. I think the quick answer is that we haven't yet. But I think that this is really important and absolutely an area that we're interested in looking at more deeply. I mean, I think that even with Asian populations, I mean, I think folks talked about this in the chat, that there's huge differences in terms of racializations across South Asians versus Southeast Asians. There's differences in histories, levels of deportations, differences in contemporary socioeconomic status, for example. And so that's something that will have in kind of the next iterations of our analyses to go a little deeper.
Thank you.
I can add to that really quick, Tiffany.
Great.
Is that okay?
Yeah, of course.
Okay. That for the qualitative portion of the study, we focused in just on 2 specific country of origin groups. And that was really great feedback that we got from our technical advisory committee so the qualitative data really kind of gives us the chance to go in depth in 2 specific groups that are two of the largest immigrant groups in California. So to sort of kind of address that side of how there's possible differences within 2 very heterogeneous groups.
Thank you. Immigration status is a sensitive question in the California Health Interview Survey. How do you think non-participation among undocumented persons and missing or dishonest responses may have affected your analysis?
I can answer that. I think it's such a great question, and it was something that we were really careful and thoughtful about. So first of all, I can't speak to this, but I know Nadi and others have done incredible work with the California Health Interview Survey to ensure people are comfortable responding, and with actually analyses have been done that really show there's a very, very little kind of non-response or inaccurate response of those questions. In terms of some of the rights questions, we had a lot of feedback from the advisory board. We piloted it in the community to make sure people felt comfortable with the questions. And then as the interview was being fielded, our team was regularly listening to recordings of the interviews to hear how people were reacting to the questions. And I would just say that, and having listened to some of those recordings, people were very forthcoming, and I would even say eager to share and report their experiences. And from the experience during the qualitative interviews, many people were sort of felt good and positive about the opportunity to really share their experiences. And so I think setting up the sort of rapport and comfort actually gave people an opportunity to share things that they really did want to share.
If I can add to that, so the CHIS questions about legal status have been around from the beginning. These questions have been asked for the last 20 plus years. So there is quite a bit of consistency in terms of responses. We also conduct additional analysis in the process of identifying who might not have documentation status. And one of the things that we do is cross-validate among some of the groups where we can, for example, naturalized individuals that report naturalized citizenship status. We look to see how many years they have been in the US, because we know that if you've been in the US less than 5 years or so, then you're not, you're less likely to actually have that status. The number of people that we identify that may have been inaccurately reporting naturalized status is really small. So in terms of green card status, we have tried, but it's a much more difficult question. As you probably know, in green card status, you could have a green card but not have necessarily lived here that long. So it's much more difficult to identify that. But you know, we are trying to have relatively validated categories. But I think the fact that people have been responding to these questions without many problems over the last few years bodes well for our assessment of legal status.
Definitely. And while we have you off mute, actually, Dr. Parat, somebody has a question about the negative perceptions fact sheet. To what degree, they're wondering to what degree the negative perceptions about public charge among the unintended groups were due to living in families with mixed immigration statuses.
And that's a great question. As you know, I think questions from way in, who knows the CHIS survey from its inception, CHIS is not inclusive of every member of the family. We have done work in the past where we try to the degree possible, identify when people are living in mixed status families. That's definitely a question. And remember, when we were looking at the perceptions, we know that these perceptions could be formed not just from personal experiences, but the experiences of the family members, other friends, the community, the media. So it is, we do believe that the perceptions are because, you know, whether it's from personal experiences, is also has to do with what else is going on in your immediate surroundings, as well as the community you live in. So I agree with you. That's a good point.
Thank you. The findings of relationships between experiences of exclusion and delays in care are very interesting. Do you have information or ideas about what it is about experiences of exclusion that lead to delays in healthcare? Is this something you will be able to examine?
Yeah, that's a really great question. So in terms of sort of explaining the results, I think there's sort of two possible things going on. These experiences have happened at some point in a person's life. And so there's a sort of a sense of how experiences of exclusion might shape people's trust in institutions and their willingness to seek healthcare services. It's sort of, our hypothesis is that these experiences as exclusionary experiences really sort of shape how people experience a sense of belonging and a comfort in navigating the healthcare system. But also, we're also looking at some health outcomes to try to understand if these experiences also are a source of chronic stress that could have sort of over the long term have a wear and tear on people's well-being. And we're sort of seeing similar patterns in terms of people's self-reported health and their sense of experiences of psychological distress. And so I think that these experiences overall are examples of discriminatory, stressful life experiences that can really deteriorate a sense of belonging and also create other stressors, whether it be economic stressors, so a sense of like, I can't leave my job to go to a medical appointment because I'm freaked out about, what my employer might do, or sort of a more immediate, just sort of sense of sort of struggling with day-to-day mental health issues because of these traumatic experiences. So our analyses will kind of continue to look at and try to make these connections.
Thank you. What types of analytic methods do you use to stratify data both by country of birth/origin and race ethnicity? Is it reasonable to examine certain questions by both country and race/ethnicity due to possible different health risks and experiences from country versus US experience related to how racism is experienced uniquely in the US? We can break that up into two parts if it's easier.
I can start and others can join in. I think the two concepts overlap, but they're not necessarily equal. So you could be there, race ethnicity varies by the country of origin. So we haven't necessarily disaggregated the country of origin yet. One of the challenges that we have is, having adequate number of respondents from a country before we can break down the data. It's so fine, our total sample was 2,000. So that sort of limits our ability to sort of link country of origin to the race/ethnicity to the outcomes. So we have to consider all of those as we are doing the analysis.
Thank you. Does anyone else want to add anything, or should we move on to the last couple questions?
I can just add really briefly. I think one of the big challenges here is that we're thinking about immigrants both as being part of a particular perhaps ethnic or national origin group, but also as individuals who are racialized into the US context. And so one of the ways that we think about these measures as these are racializing experiences. So while we're using statistical methods to look at interactions by race and ethnicity, to be stopped and racially profiled is itself shapes what it means to be an Asian or Latino person in this country. And so the experiences themselves are kind of intertwined in terms of defining even what these different categories mean.
Thank you. Can you discuss the validity of the questionnaires? Was a pilot test conducted?
There was a lot of work done in terms of developing these questionnaires. And I have to say that in terms of, we're doing some psychometric analyses right now, but it really started out with the conceptual framework. These are really theoretically and conceptually based measures. We then did some pilot testing, but right now, and we also worked with the Community Advisory Board in terms of wordsmithing and making sure that it's comprehensive. Our Community Advisory Board is also from the specific policy sectors themselves. And so we made sure to try to be as comprehensive in these measures as possible. And then now that we have the data, it's been really interesting to actually look at some of the reliability, so alphas across some of these measures. And we're seeing really high alpha. So, above 0.7, above 0.8 for some of these measures. We're happy to provide more specifics for specific items, but as a whole, these policy domains tend to hang together like we hypothesized that they would.
Thank you. Before we get to the very last question, we did have one shout out in the Q&A asking for potentially looking at this information on differences by gender. So just something to think about.
We've actually looked at some of these by gender as well. So really quickly, just as a very brief overview, men are more likely to experience higher levels of law enforcement experiences, while women are more likely to experience levels of healthcare exclusions and education exclusions. And so stay tuned for that, because I think that especially looking at this over time and looking at some of the ever versus never undocumented and how that might change trajectories might be really interesting by gender in particular.
Great. Last question. I'm curious on how we can go beyond bringing awareness about immigrants' rights when the approaches taken by law enforcement are often aggressive and based whether they believe a person may be undocumented.
I can speak to that. I think awareness is not enough. And that's something that we've felt right from the outset of this. And I think kind of our message, even just in today's webinar, is that California's made incredible strides in enacting sanctuary policies, but there's more to be done. And I think that it's a structural response. It should not be on individual immigrants to daily have to contend with and navigate all of these exclusions. There needs to be a policy response to make sure the protections that we have established at the state are coming to fruition in people's day-to-day lives.
Can I also just add that I think that this project is really about taking a multisectoral approach and working across policy domains to hold institutions accountable, and not just being aware of immigrant rights, but ensuring that these rights are implemented and practiced in the everyday lives of immigrants.
Absolutely. What a great way to end. So those are all the questions we have time for today, ending almost exactly at 1 o'clock. I just wanted to thank you all for joining us for this month's webinar, highlighting research by our rights team. We will be posting the recording of this webinar online with closed captions within the next 2 weeks. You can visit healthpolicy.ucla.edu/seminars. If you'd like a copy of today's presentation, or you'd like us to send you a link when we do have the YouTube available, you can email us at healthpolicy